Thank you for joining us for this session, New Voices for Spina Bifida. This topic is going to be about Medicaid insurance coverage for children and young adults, sponsored by Attenda's Hygiene Partners. And to tell you a little bit more about New Voices for Spina Bifida, this is a series of sessions of presentations by industry experts that address the medical and social needs of individuals living with spina bifida and their families. Today's topic on Medicaid insurance coverage is being presented by John Shiner. John has 21 years of healthcare sales experience in acute care, long-term care, and home care. He is Vice President of National Accounts at Attenda's Hygiene Partners and is considered an expert in Medicaid reimbursement for incontinence supplies. He also has experience working directly with managed care plans, Medicare Advantage, and state waiver programs in all 50 states. He is an advocate for patients and family members who need help finding various types of medical supplies, such as for incontinence and urological and enteral nutrition. His experience is both personal and professional, as he has had to navigate coverage and supplies with his own family. So before we get started, I wanted to mention just a couple of things. You will be muted throughout the session because we want to give John the opportunity to cover all of his material. John will also strive to answer any questions that you might have during the session. For that, please use the Q&A feature. You can also use chat, but it makes it easier to monitor if it's just through the Q&A. We are recording this session, so everyone who registered for this will get an advance version of the recording. It will later live on our YouTube channel. We have enabled closed captioning. And finally, and lastly, just want to thank John and Attenda's Hygiene Partners for their generous support and for this complimentary webinar today. And so now let's turn it over to John.
Thank you, Juanita. Thank you, Stephanie. Appreciate it. Hi, everybody. My name is John Shiner. It's great to be with you, and hopefully you can see my slides clearly. As we noted, the session is called New Voices for Spina Bifida, Medicaid Insurance Coverage for Children and Young Adults with Special Needs. Share. So I work for a company called Attenda's Hygiene Partners. We actually are a manufacturer of adult and pediatric incontinence supplies, and we also have a billing division, professional medical fulfillment that specializes in the waiver space by state, as well as a Medicaid billing and managed care billing company called Home Delivery Incontinence Supply, also known as HDIS. The brands we sell are Comfies and Attends, and that's about it as far as I'm going to talk as far as about what we make, because this is not really about a brand or a company. I'm here with from what I see as resources that hopefully you can use. We make everything from every size of adult product to every size of pediatric product and everything in between. And these products are available to you at acute care hospitals, long-term care facilities, home health care providers, and retail providers. Everything from Target to Walmart to Walgreens. These products are different variations of them are available in different outlets. This is my personal why. So I'm from Pennsylvania, East Coast, outside of Philadelphia. Went to St. Joseph's University, have a degree in business. Been here, as Juanita said, 21 years and counting. It's basically my second job out of college. And I enjoy sports, especially Eagles football. I'm a season ticket holder. I like cooking, vacationing with our family. We actually just got back from the Bahamas for spring break. So really exciting to work where I work. I travel the country and I work with folks like yourself, and also with businesses that have a license to build these products. My personal journey started with my daughter. She first, let me say that she does not have spina bifida, but I'm noting this because I understand, for the most part, what it's like to get a patient covered by Medicaid. It can be extremely difficult, extremely frustrating. I'll be honest, it's a soft spot for me every time I talk about it because of how hard it was. So my daughter was basically born with deafness, right? So she was a candidate for a cochlear implant, if anybody knows what that is. Basically, they go into your head and they implant a hearing device into your cochlea. Long story short, it costs $350,000, and obviously nobody can afford that. And we said, well, what are we going to do? And we went right into the doctors at Children's Hospital, which were absolutely phenomenal, and the resources that they have there. But they immediately told us about Medicaid, and they said, you don't necessarily have to have a certain income level to apply or be eligible for Medicaid. And in Pennsylvania, there are 5 or 6 managed care plans that cover Medicaid for children and young adults with disabilities. So we were frustrated. We didn't know what to do. We had a short window to do the surgery, so we did it. And this is my daughter, Brooke. She's now 10. She had the surgery at 3. Long story short, she's A+ in school, mainstreamed, and she can hear again, which is phenomenal. I say that because as we go through these slides, I understand. So we're going to get right into what is Medicaid. In order to talk about Medicaid, I have to mention Medicare for a second. Okay, the official definition of Medicare or Medicaid. Medicare and Medicaid are both government-funded healthcare programs, but they differ significantly in their eligibility requirements and the services they cover. Medicare is primarily for individuals age 65 and older. Some younger people with disabilities or end-stage, and some younger people with disabilities or end-stage renal disease. Medicaid, on the other hand, is a joint federal and state program that provides health coverage to low-income individuals and their families, regardless of age. Medicaid can also cover children and young adults, regardless of income level, depending upon state rules and available services. So this is where if you're not familiar with it, it can get slightly complicated. There are a variety of different types of Medicaid. We have everything from children's health insurance programs, which is also known as CHIP. We have managed care insurance, which the managed care insurance companies actually contract with each individual state. In your state, you could have as many as 1, 5, or some states even have 10 or 15. It just depends upon the size of the state and the budgets that they have worked with. The old way, I shouldn't say it's old because it still exists in certain states. Medicaid in a state program, like I live in Pennsylvania, before 5 years ago, there was only Medicaid in Pennsylvania. So they've rolled out 5 managed care plans in Pennsylvania, and they force folks to pick from a managed care plan to deliver care and services. The third version of insurance or Medicaid is MLTSS, which stands for Managed Long-Term Services and Support. This is basically, it refers to a capitated program. It's when we talk MLTSS, typically managed care plans put a cap rate on a subset of services. So if someone needs to be in a facility and they need incontinent care supplies and enteral nutrition, they would take a look at what the doctor ordered for them, and they would cap it based on the monthly allowable that each state permits. And then they would multiply that by 12, and that's the cap rate or thereabouts, general idea. The fourth version, which is somewhat widely known or available, is SSI, or Supplemental Social Security Income. If a child qualifies for SSI due to disability and low income, they also receive Medicaid coverage. So that's a fourth option, just different terms I'll share as we move forward. Specific Medicaid for children in the Pennsylvania example, which is what we have, it's an approval regardless of parents' income level. Medical assistance coverage to children with various disabilities. So deafness for us was one. I'm sure spina bifida is probably another. Social Security guidelines are used in many cases to determine disability and eligibility. And then documentation of a child's disability is very important. Evaluations from doctors, therapists, and they all must be completed for application. It takes quite a long time. I think it took us, we went through a couple peer reviews to get our daughter covered, but the doctor ultimately signed off, wrote a prescription, and then we were able to get approved for Medicaid. So try to keep it simple at the top of a lot of these slides. So how do you apply for Medicaid? So you would contact your state's Medicaid agency, which is, they have specific information on eligibility requirements and the application process in your state. You check for disability specific programs. There's something called the Family Opportunity Act that may help you with that search. And then the next part is super important. You have to have all your documentation ready to go right away when you are on these websites or in any application setting. So name, date of birth, social security number, your address, income documentation, pay stubs, W-2s, proofs of income. Even though, you're not necessarily targeted or looked at for a specific income, they still make you provide whatever your income is. They want to see that. So it gets pretty invasive. Then you'd have disability documentation, proof of citizenship or immigration status, and then household members and lists of other benefits received. So they would, if you had various children, you'd list how many children you have, and who's there as caregivers. There's also state Medicaid websites, which that's where the online application portal comes in. You can apply for disability specific programs right online if your hospital or caregiver hasn't already helped you. And then you choose a Medicaid plan. As I mentioned many times, Medicaid plans are owned by managed care or serviced by managed care plans, and there are many to pick from. Pennsylvania, there's 5. New York, there's 12. Different states have a different total. If you don't like what you see at one, I urge you to try another. In our business, believe it or not, we have people that switch quarterly or have switched quarterly because of one reason or another. And they all serve Medicaid, and they should have similar services. And you may have different options for different types of products during that search or when you look into those plans. The next thing, I think Medicaid, I think a lot of folks know about it, generally speaking. This next one, what is a Medicaid waiver? If you've heard of a waiver, Medicaid waivers kind of sit between an insurance plan and a cash sale. So let's just use incontinence, for example. Let's say you're not on Medicaid, even though Medicaid covers incontinence, and you don't want to pay cash for a product. In many, but not all, I want to preface it because I don't want you to think this is just widely available everywhere, but it's available in most states. There's what's called a Medicaid waiver. And a waiver is a permission granted by the federal government to states to deviate from standard Medicaid rules. This allows states to experiment with different ways of providing care, expand services to specific groups, or address unique needs within their state. Examples of this, waivers can allow states to provide home-based care for people who might otherwise need institutional care, and they can expand coverage to certain populations. While there is flexibility, they must still meet certain federal criteria and not exceed budgets for Medicaid. I'll talk about it in a second, but whether it's Medicaid or a waiver, typically there's a billing rate or a capitated rate in a lump sum that they can have different waivers, but it still has to stay within a specific budget that's set forth by the state government. There are 2 widely known waivers in our business. One is, and you may not know the numbers, but this is like, if you were to look this up, this is how the federal government goes by it. So it's the 1915C waiver, which has been around for a very long time. It's the Home and Community-Based Services waiver. And the second one is the 1115 waiver, which is the section of the Social Security Act that gives the Secretary of Health and Human Services authority to approve experimental pilot programs. Typically, these are five-year periods of study. Today, if you added up all the states and all the waivers in each state, you'd arrive at somewhere over 257 versions of this waiver type. So it serves many different disabilities and many different many different children, as well as young adults and even adults with disabilities. These programs tend to pay for a set monthly allowable and a lump sum versus a product-specific code that's needed. So let's say you need 5 different types of products. It could be enteral nutrition, it could be catheters, it could be incontinence, it could be gloves, it could be a walker or a wheelchair. They have a set amount for each person once you're approved on the waiver. I will say, and it is a caution, there are wait lists for a lot of these waivers, and it just depends on what exactly you need and how you may be approved. So who can help me start this process? There is so many different starting points, and I know it's confusing or can be. It honestly may be 1 or 2 at the same time, sometimes 3. It depends on who will say yes first. So hospital case managers and patient care coordinators is where we started. Every hospital has this type of person. Their title can be different. I've seen probably 5 or 6 different titles of this same person. It could even go right down to social worker or, a nurse that happens to work in a specific discharge unit. There are also independent case management companies. We know of, so my company is actually based in North Carolina. There's more than 15 different case management companies in North Carolina that serve this population of folks with disabilities. So they're very used to these conversations and can also assist with approval for insurances. Depending upon your Medicaid insurance option, the insurance plan itself can have case managers. We have multiple contracts. We have 164 managed care contracts in 40 states. And, there are case managers that work for those insurance companies that actually work one-on-one with patients with disabilities to get them covered under their plan. The next area would be the state and national entities, many different agencies and names of locations, and they do vary by state. So these are the ones that we work with closely. Okay, I'm not saying there's not more, but I tried to think of all the names of the entities that we work with in the waiver space. So Easter Seals is a national program. We work with the Easter Seals of West Georgia closely with hundreds of patients. They are a phenomenal resource. And I would probably recommend that most Easter Seals could answer your questions, even if they don't necessarily serve or help folks with spina bifida. They may be able to direct you in the right to the right location. Next, and some of this terminology gets state specific. So Human Service Districts in Louisiana, another great agency group. Typically in Louisiana, they list them by the parish. So I think there's over 20 different parishes where they have a human service district. Next, in Georgia and Missouri, they have community service boards. In Alabama, they have what's called County 310 boards. And then another common name is family support providers. Specialized medical supply providers comes with a set max allotment. So these folks will actually help you and the state set the budget for your child or your family member that needs services. I used a fairly exact number because it's one that we have in Georgia, and it's $4,069 for supplies for the types of products that we manufacture. So incontinence, enteral nutrition, and they basically divide that up by 12, and you get that allotment whenever you need it, but most of the time it's every single month. And then the last thing is the caregiver program. So what to look for in a product and supplier. I am not going to be biased here because I think it's too important. There are a lot of different products out there in the incontinence urological space, as well as enteral nutrition. Everybody makes great products. I will say that different products come to meet different needs of your patients and family members. Just because there's a brand that you see at Walmart or in Target doesn't necessarily mean that you're going to see it from your medical supplier. That's not a bad thing. In our business, there is retail products and there are what we call institutional products or insurance grade products. Transparently, most of the products that are going to be dispensed through home medical suppliers are all slightly better than what you'd find in a retail store. So just because you see a brand name, let's say it's a competitor of mine that's in the retail setting, which we're not, called Depends. Depends is like Kleenex for tissue. It just because it's on the shelf, people think it's the best. Trust me, there are many other brands that we compete with that, including our own, that could be better. So don't always think that a brand you see is the brand that you should go to because that's what you see on television. Third, think about product type, the size, the overall fit, and the comfort. I can't stress enough that if these three areas aren't really looked into, it doesn't matter how good or bad the product is. The product's always going to be bad if it doesn't fit correctly. And that goes for the most absorbent product on the market. So you want to make sure it's sized correctly. I'll show you what that looks like in a second. And you want to make sure your son or daughter or family member is comfortable, because if they're not, there may be a different size or a different brand available from these suppliers that can help. If it's a nutritional product, there are two main brands, Abbott and Nestle, that make great products, and they both have similar flavors. So you have vanilla, chocolate, strawberry from both. You have different caloric units in all the different cans and the product put-ups and SKUs. You can use trial and error to see which is better, but and you can also ask your doctor if you prefer a specific product, because in our world, from a billing perspective, they should both be interchangeable, assuming that the home medical supplier has access to it. If Medicaid, if you're not on a waiver and you have Medicaid, the prescription for the product that the doctor or case manager helps facilitate is what you receive. So I'll show you example forms. They're almost like prescriptions, but they're for medical supplies that we have either the doctor or the case manager fill out. And then our company or many companies will actually call the patient to make sure, or the family member to make sure that they have the right size. This is what the doctor put on the pad. This is what you agree to. But what is put on that prescription, it will be used to select the product type, the size, and the caloric count in each can or in each case. So you want to make sure that whatever the doctor writes the prescriptions for is what you intend to use and what you end up liking. And if it's not, changes can be made, but they do take a little bit of time. Not like months, but maybe weeks. So what to look for in a supplier? We're a supplier. There are hundreds of suppliers out there. We're a manufacturer and a supplier. So we make the products, but we also can build the Medicaid programs, and we can also go through the waiver programs. These are called home medical equipment dealers, or some folks hear the term HME dealer, home medical equipment. This is where you would go to get questions answered and look at resources. These places have a license to bill and provide for the products that they have in their store. Today, they are both online and they have brick and mortar locations. Me being here for 21 years, I get to know like the terms and whatnot, but I used to think of these as like surgical supply stores. So many towns in the country, across the country, have them. They're mom and pop home care dealers that serve wheelchairs, walkers, canes, commodes, have incontinence supplies. They may have wound care, may have shelves with different supplies hanging on them. They sell those for cash, but they also more than likely will have a license to bill the insurance or can also help act as a resource to get on a waiver. The one thing I say, no matter who you choose, look for responsible service and variety within a category. In our space, we make 10 different levels of absorbent hygiene products. One absorbent hygiene protective underwear is totally different than the next. It could be a fit thing. It could be an absorbency thing. One could have a leak guard. One could not. One could be for a male. One could be for a female. It is amazing when you really look at the options that are out there. And honestly, it is confusing. And we know that. If you ever walk down an incontinence aisle in a grocery store or pharmacy, you see a lot of colors and you see a lot of descriptions of super, maximum, heavy. No one knows whose maximum and whose heavy is better than the next guy's ultra. So we understand that. Sometimes there is trial and error that goes through this that you need to go through, but we try to help with all those decisions. The next thing is on-time delivery. Assuming a company has all the correct prescription data, the product should be available to you within a week. But I want to stress the first part I said. You have to have the prescription data correct for any medical supply company to be able to bill it correctly, and they will not bill it, or they will not ship it until they know they have the correct forms that they can submit to your insurance. Most of these products are, well, I guess the next thing is on-time delivery. We want to make sure that the product gets there, but most of these products are shipped in 30-day quantities. It's also called a 30-day allowable. So whether it's enteral nutrition, incontinence supplies, catheters, they have a set amount that you are entitled to every single month. You don't have to take them, but you are entitled to them. And usually by law, actually you have by law, the companies have to reach out monthly. Typically this is via text or a phone call, and they'll ask you, does Mary need product this month? And you opt in and you typically say yes or no. If the answer is no, it's not like they're going to stop service. They'll reach back out the next month and they'll ask if you want a shipment that month. But the best companies, I will tell you, don't just ship product because you're entitled to it. I know that sounds weird, but you want to make sure that you're not filling up your garage with product that you are not using, because it's not right for the insurance company. It's not right for you. And trust me, it happens all the time, depending upon the supplier that you use. So types of products. These are the types of products available for incontinence by Medicaid billing code. When I talk about different sizing, I literally mean we have every different size you could think of. Everything from small to double extra large. And actually, this is a slightly dated slide. There's a triple extra large pull up now as well. Everything that's for all protective underwear. For adult briefs, we have everything from a small or extra small youth product all the way through 5XL. So I didn't even add our DD70, which is a 5XL. And we have a variety of bladder control pads. I listed 2 here. We actually have 10 different levels or shapes and sizes. You'll see a code out to the right. I'll talk about that in just a second. It's a billing code that home medical dealers use. You don't need to know that, but you do if you want to know, if you want to make sure that the doctor is writing the right product in your prescription, because each code is meaningful because it designates a size. Speaking of sizing, when we talk about how important sizing is, we actually get, we're not obviously in front of everybody to size them physically. So we've created sizing grids. So we have sizing grids for protective underwear. And more importantly, we have sizing grids for, and when I say more importantly, protective underwear has elastic, they fit like underwear. So you don't necessarily need to be as accurate with protective underwear sizing because they all fit pretty snug like our own underwear does. But when it comes to an adult brief, we have a sizing grid that matches up height and weight. Height will be across the top, and actually height will be on the side, on the left-hand side, and weight will be across the top. It's similar to a women's pantyhose chart. It's not 100% accurate, but it'll get you pretty close to where we need to be. So 85% or so, and it gets us asking for the right size. I will say that bigger is definitely not more absorbent. Bigger, if you're 100 pounds and you buy an extra large, or if, I'll show you in the baby diaper section in a second, you do not want to buy a size that is too big because the product will leak. So a full line of pediatric and youth products under the Comfies brand name. We have everything from newborn through size 8. I reference size 8 because we're now one of the only companies in the world that has a size 8, and we try to work with folks with special needs where maybe the smallest size adult product is still too small. So we have youth products. Did I say small size pediatric product is still too big or too small for an adult? So we have both. We have both sizes, and we have tried to do everything in between. So we have size 8, full line of training pants for boys and girls, and then youth pants, which is like youth pull-ups. Urology products. Different products to look for. These are the two main ones you see out in the industry today, both Bard and Coloplast. We don't make these products, but we definitely build them. There's a variety of different sizes and codes that they use, and the amount of units that you get differ by the different products and brands, depending upon the performance that you need. Enteral nutrition, similar. Two main offerings, Nestle and Abbott, and there's billing codes that go along with each one. And each billing code typically goes with a certain subset of a calorie amount that you're looking for in that day or in that month when they send you cases of the product. Forms. So there are two forms typically that you see in our business, and you may see them, or your providing physician's office may take care of them for you, but you could certainly help them along to make sure you get the right products as long as you have these forms. So there's a referral form, which that's the first one, where you actually pick the product that you're looking for, or the physician will pick the product that you need, and the Medicare number or Medicaid number goes on the sheet along with your address and the patient's name, and obviously the physician's name, phone number, and fax number. There's still a lot that's done by fax these days, even though it's electronic fax into computers. So these forms are faxed back and forth between doctors' offices, just like regular prescriptions would be for pharmaceutical products. The second form is the certificate of medical necessity. This is where you would actually have the doctor fill this out and list the billing code for the product that you are being prescribed. You probably will not see the form on the right, but it is a form that the doctor needs. We need the doctor to fill out. And if there's any delay in your order, typically this is what they're looking for, or what we're looking for, the certificate of medical necessity. So what if I don't have Medicaid? What if I don't have a waiver, or I'm on a wait list? So there's a variety of outlets for cash purchases of products. I listed a company called Professional Medical Fulfillment because we do own that company. You don't have to pick them, but they are there for your help, your resource. They are a phenomenal resource located in Alabama, but they serve basically every state in the country. Their phone number's here. We can give you this after the call with a separate sheet. Their email. They can also help with Medicaid and waiver. I list them because you can also pay for these products in cash or with a credit card from this company. There are two other companies that we use as resources in the e-commerce space. They're both partners of ours. We do not own them. Carewell.com is a newer company in the past 10 years, and also Parent Giving. Both of them serve all three categories we're talking about today, which is enteral nutrition, incontinence, and urology. And then that's my first personal cell phone number, along with my email. I promise you, if I don't have the ability to help you through a resource we have directly, I can try and direct you to somebody in your state that can help. We are connected with medical distributors throughout the country. There are more than 50 of them that serve home care dealers in every state. and I am sure that we can help get you a resource. On the right-hand side, these are contacts that we would consider an intermediary, meaning you don't have Medicaid, but you're eligible for a waiver. These are just a very, very small subset of example waivers that we work with. So Easter Seals of West Georgia, name and phone number, Madison County 310 Board in Alabama, a waiver facilitator in Louisiana, and one called KIPTA in Kentucky. I could provide a list of probably hundreds of these. So please reach out if you feel like you can't find something on your own. The other thing we have, and I can't, there's just too many to list here. We have a national list of physicians in each state who accept Medicaid and are incontinence and urological product specialists. So every state has a top-down list of the prescribing physicians that write the most prescriptions for these products, and we have access to them. And if you don't have a doctor or your child doesn't have a doctor, we could probably give you or point you in the right direction. And I think that is my last slide. So if there are any questions, I can look in the chat real quick, and we can go from there.
John, this was amazing. I mean, this was so informative and so interesting. And we did get 2 questions in the chat that I'm going to ask you. And then just so that everyone can hear them who's still on. And then Juanita will ask you some that were submitted prior to the session, if that's okay, if we have time for that.
Sure.
The first one is from Adriana, and she is asking, when do we apply to Medicaid for a young adult? My daughter turns 18 in August. This transition is so scary.
So our president of our company has a child with special needs, and he just went through this process. So his son was receiving services before he turned 18, and now he transitioned to another program after the fact. So I would say now most programs, and again, this is where I'm not 100% sure because it does vary by state. Some states it's 18, some states it's 21. So I would start now with looking at the different resources for Medicaid, and you may find in a state it may be the MLTSS plan, Managed Long-Term Services and Support, that may pick up the coverage. In North Carolina, I know that it's called a CAP waiver, and they can help you. But if you, we can try to figure out what state and where, and go from there.
Great, thank you. The other question we have, and I think you did kind of mention one of the resources on one of your last slides. And am I echoing? Sorry.
No.
Oh, okay, maybe it's just from my speaker. I'm going to read this one to you. In Georgia, my son was denied Medicaid based on income only. We were then told to apply for Katie Beckett. I'm guessing this is Georgia's only disability-specific program. He was denied Katie Beckett because he isn't disabled enough. Even after an appeal, he was denied again. Is there another program in Georgia that I'm missing? He was finally approved for Easter Seals Champions for Children, and it is so helpful, but his medical tests and needs annually are still too expensive. Is there anything else in Georgia that you know of?
I listed the one Easter Seals location in Katie Neal at the end there. She's a phenomenal resource for us. You may want to reach out to her just to see if she can recommend something else. If you email us, I can give you all of our resources in Georgia. There are over 20 different areas of service providers that we could look for. The other recommendation, and again, just I don't know if this is 100% accurate or not, but you may want to ask a doctor or a Medicaid specialist that could potentially point you in the right direction, and we can give you that as well. So we have a list, the top-down list in Georgia of different Medicaid physicians that handle these types of products or these types of requests.
Okay, and I think that that's wonderful. That's actually something, we have another adult with spina bifida who's kind of, and also in Georgia, who's having a similar issue with Medicaid. They've just reduced the quantity of certain supplies per month, and
Yes.
it's causing them to pay out of pocket for her needs.
Yeah, the quantity for incontinence supplies is usually anywhere from 192 to 300 individual eaches per month. So I'm not sure if that's the product, but it does depend upon the state, but most of the time it's between that range. Some of them are in that average of about 240 or 250, which is 6 or 8 per day in many cases.
Okay, great. Thank you. And then the last one that I have, and then the next, and then I'll turn it over to Juanita, is our urologist says that Medicaid won't always cover incontinence supplies, specifically for spina bifida. Should we ask our primary care physician? Are there specific codes that are needed? That's from Sarah.
I would ask your primary care physician for sure. I would also, yes, there are codes, and we can provide you a list of those codes. They were listed on the slides. I have catheter codes as well as incontinence codes, and maybe they need to show the physician, hey, we know these products are covered under Medicaid. It's a matter of, does the patient themselves have Medicaid approval, I think is the real question. But the products themselves under Medicaid are covered for sure.
Yes, if there's a way, maybe after the session, John, that you can send us that slide and a PDF that has the codes and some of those resources, we can email it out to all the attendees as well.
And then there's one from Shannon here I'm seeing. Let me just
yes.
Do you have a list of resources and a list of doctors for the state of Wisconsin? Yes, I do. I certainly have the list of doctors. Let me we can get you our contact information, and we can send that to you, and then I can research the list of resources for waiver and Medicaid in Wisconsin. I know one of the plans for Medicaid in Wisconsin is called Inclusa. It used to be, I think it's still called Inclusa, but they were purchased by Humana recently.
Thank you. And John, maybe one thing that we can do is we can share how people can access that list when we send this recording out to everybody who registered.
Okay.
So that's another way we can get the list out. But we have more questions. And I wanted to go back to the question from the family member of an adult in Georgia, the same person who also had reduced the quantity of certain supplies. But the other issue that this person is having is that in Georgia, there is not an adult spina bifida clinic.
Okay.
So the types of services that this person needs are not available in her state. There is an adult spina bifida clinic in Alabama within relatively good driving distance. However, she's unable to attend that adult clinic in Alabama because they do not accept Georgia Medicaid. Do you have any suggestions?
I'd have to think about that one. I believe we have more resources in Georgia that I can give you, and I think the list that I'm referring to would be most appropriate. Georgia is actually one of our largest states that we serve, so I could certainly provide that. And then in Alabama, that's where actually Professional Medical Fulfillment is based. They're in Opelika, just outside of Auburn, just down 85. So definitely something that we could try to further research.
Very good. And I apologize if, just let me know, we already asked this question. Our urologist says that Medicaid won't always cover incontinence supplies specifically for spina bifida. Should we ask our primary care, and are there specific codes? that are
Yeah,
needed?
I think we did answer that, and
Okay.
I'd say yes, there are specific codes, and I can certainly provide them. Ask the primary care, and this is the part that I don't quite always understand because certain states it is covered, and other states sometimes it's not. But we would try to look for that waiver if for some reason it's not covered.
And
Yeah.
and so there was a clarification. It's diagnosis codes. The diagnosis codes, are they the same as the other codes?
They may not be. The codes that I was referencing are actual billing codes by the size of the product or the type of the product. We can look at the diagnosis codes as well. Our Medicaid specialist, if they call us, could try to help them with that.
Okay. Very good. All right.
There
So
you
we
go.
do
You
have
can ask providers for the diagnosis codes. They're ICD codes, ICD-10. So if you Google ICD-10 codes, that's the codes that we're talking about. And there's different types of incontinence that are coded separately. And then there's another question here. It's actually a separate subset. So it's Sarah meant to say, I meant codes like urge incontinence or overflow incontinence, not the codes for supplies. Unfortunately, for what I've seen, incontinence typically is either a pull-up or a brief, and you would need to go, or a pediatric training pant, you would need to go to somebody that has a variety of products that may be able to help with a more absorbent product or provide a more absorbent product if you explain to them that you have a overflow incontinence or urge incontinence, because there's different liners, there's different bladder control pads, briefs, and protective underwear with different absorbencies that may help. But if someone says, "Oh, I'm only given this product for Medicaid," you may want to look at another provider because they may give something else.
Very good. Thank you. All right, some more. Can you have both a marketplace plan and Medicaid?
Again, this is where my boss thinks I'm an expert, but I don't know the term marketplace plan with Medicaid. So we have Medicaid in Pennsylvania through a company, through Keystone First. My company's health insurance is through North Carolina Blue Cross Blue Shield. So we have both. My daughter has both. So in that regard, yes, but it may be state specific. And then someone just said, no, you cannot have a marketplace plan and Medicaid.
And then, okay, somebody said that they've heard that people can have both Medicaid and, excuse me, hold on a second, I lost my question. Yeah, I've heard that people can have both Medicaid and Medicare. However, which is, whoops, so sorry, technical issues. However, which is better for the long-term coverage for health insurance for people with medical bills?
Say that one more time.
It says, I've heard that people can have both Medicaid and Medicare. Which is better for the long-term coverage for people with medical bills? Long-term coverage for health insurance for people with medical bills.
If you're eligible, in my opinion, from what we see, if you're eligible for Medicaid, it would be Medicaid. Because Medicare doesn't cover incontinence.
Because Medicare doesn't cover incontinence. Okay.
Yeah, Medicare, long-term Medicare does not. It's only Medicaid. I think for urology, you may be able to get it covered, but I am not familiar with as much with Medicare and urology. But for incontinence, for briefs, pull-ups, that they do not cover it. Medicaid does.
Okay, so then we have possibly similar questions about how to get coverage for diapers for an almost 6-year-old, and how do you get supplies, it doesn't specify the supply, but I'm guessing it's also continence. Covers for diapers for an almost 6-year-old, and how do you get supplies for a 2-year-old?
So almost 6-year-old would fit into the window of coverage with Medicaid or a waiver by definition, because they're over, I think it's over 4 is who we serve. I mean, a lot of times we serve sizes 3 and up. It doesn't necessarily mean it's age specific, but to my knowledge, at least from my experience, and I'm not necessarily 100% sure on the state, but most of the states do not cover children under the age of 3 for
Okay.
Medicaid. Waivers, different story.
Okay. Thank you, Sarah. I noticed that a couple things in the chat as well. But okay, so here's another question. What happens when you're moving? So the question is what happens when you move while you're receiving services for a waiver, for example, in Ohio? Who needs to be notified?
I would contact everybody you contacted when you applied for the waiver or you applied for Medicaid. We have to apply for Medicaid every single year. So just because you get it one year doesn't mean you get it the next. I mean, obviously, you have long-term disabilities, they're going to typically approve you, but every single year we have to provide all the same things we've provided when we first applied. So every January. If you're moving, I would take that same step, like, just to make sure that they have your new address and everything else is the same as far as who's living there and your job and everything. But if you're moving jobs, you probably have to provide a new W-2 or income statement or form.
Okay. Very good. Thank you. So in the case that Medicaid might have mishandled a case and then the person lost Medicaid, how can a person try to get it back if they lost Medicaid at some point?
That is something that I am not familiar with. Typically, there are a lot of other circumstances that would come into play if someone lost Medicaid. It could be something related to income. I don't know the answer to that question, to be honest.
Very good. Okay. And we have a few more. Thank you for answering all these questions. So what about insurance coverage and benefits for those who don't meet a low income status?
I think that is a state by state rule. And it also goes by whether, I know there was a comment about whether a doctor or a state felt that spina bifida should have get products covered, or someone with spina bifida should have products covered. I think that's a state rule. Pennsylvania is very good with all disabilities, but I've also heard our neighboring state, New Jersey, is not. So I think it would depend on the state.
And are there any options for someone who is not on Medicaid because they are working? For example, there's another example of a person with spina bifida who is an adult that lives at home but works part-time. What are some Medicaid options in that?
I would think so, because if you work, in many states, it's not necessarily about your income level to be able to get Medicaid. So again, I think that's more of a state specific question. We could try to call our office and find out.
All right, and then here's another question that probably a lot of people have, and I'm not sure if it's something you can answer, but how would potential cuts to Medicaid impact what you've been discussing today?
It's a really good question. Every state has what's called a fee schedule for these products. So if it's Medicaid, straight Medicaid, let's say it's New York Medicaid, there's a straight what we call 100% of reimbursement, which is what these home medical dealers get paid to provide these services. Unfortunately, if there are further cuts, it would really impact the care delivery model for these types of products, because there already have been cuts almost every single year for the last 10 years in this space. And what happens is these home care dealers end up continuing to cut the quality of the product. So yes, they're delivering a pull-up or a brief, but they can't afford to give you the most absorbent product anymore because the state won't pay for it. If it's at all possible, you want to go or err towards health plans that are either at 100% of Medicaid, meaning the state still owns the Medicaid plan, or if it's managed care plan, there are different managed care plans that cover different levels of reimbursement. So managed care plan typically doesn't reimburse at 100%, but you want to try to find one that's not paying the home medical supplier 50% either. Typically they average around 85% of the fee schedule, and you can still get a decent product for that. But if they were to cut more, unfortunately, it would affect the quality of the products that they are delivering. I don't see how they can, because that's how much has been cut already. But I guess you never know.
Okay, well, that was it for the questions, John. So again, I want to thank you so much, and thank you to all who have attended and who submitted questions.